Death is a hard topic to process, your own or your loved ones. There are a few different types of death: biological, clinical, social, and psychological. Biological death references to your organs ceasing to function. In clinical death, your brain stops functioning. Socially dying would be when you're socially isolated, whether by your own doing or external forces. And psychologically dying is accepting and coping with your own death. It's generally accepted that there are 5 stages of grief. The stages of grief are denial, anger, bargaining, depression, and acceptance. Denial is the shock that helps us accept our grief, like finding out that you'll have a disease that can kill you and then denying that you have that disease. Anger can push you to hurt your close friends and family and question your belief in a higher power. Bargaining. Guilt or fear pushes you to make what-if statements and try to negotiate to get the life you had before back. This can cause you to pursue risky treatments to your ailment or engaging in risky behavior. Depression. It is the most present emotion and represents the emptiness we feel when truly living in reality. Acceptance. You come to terms with the situation that you are faced with. This is the Kubler-Ross model. This model was developed by Elizabeth Kubler-Ross, a Swiss doctor that was a hospital volunteer during World War II. She helped revolutionize how to care for the terminally ill. This is the common way of viewing grief, but of course there are other ways, as humans are not robots and have individuality. Some people are naturally better at processing grief. Others can let it bottle up and avoid it. This isn't healthy and can lead to the grief choking other parts of your life, and it can help you develop a fear of death and dying. You can also pursue grief counseling, or you could turn to a trusted friend. Death is scary. Humans have been trying to find ways to counteract it for millennia. From begging your God for immortality to creating elixirs of life, it can be said that nearly everything has been tried. It is difficult to imagine never seeing your loved ones again, to imagine the concept of the opposite of everything you've ever known. Over the centuries, there have been many different ways with dealing with the dead or dying. Nursing homes give the promise of a homely environment where your loved one is surrounded by friends and round-the-clock care. However, there is much anxiety about leaving a loved one at a facility where you can't control the day-to-day conditions, and not without merit, as there have been nursing homes that have taken advantage of their patients. For these people, in-home nurses would be much less stressful, for the dying can live out the rest of their lives comfortably in their own homes. Though hard to talk about, it's beneficial for the dying and their family to discuss after-death care of their body and the will. You don't want grief-stricken family to be fighting over whether you would have wanted to be buried or cremated or where your assets should go. Decide for yourself and get a will finalized with a lawyer. An ancient Chinese emperor, Qin Shi Huang, dating back to around 2,000 years ago, commissioned alchemists to create the elixir of life to grant the emperor immortality. Unfortunately, due to their lack of chemical knowledge, one of the ingredients in these elixirs was mercury, and is probably what caused the death of unified China's first emperor at 49. Many people are just as fearful of their deaths, but so many people also focus on the mysterious afterlife. So many of the world's most prominent religions say that a person must act piously in life so that they may achieve a favorable and happy eternity in the afterlife, if there is one. Christianity tells us to avoid sin and live by the Bible to gain entrance to heaven. Buddhism says that we must act favorably to attain better lives in each reincarnation until nirvana is achieved. Quite ironic that religion teaches us that we must live for a better death. But many people find comfort in that they or their loved ones will be in a better place than they were before, that they will know eternal happiness. Some people find comfort in believing that there's nothing beyond life. However, death is a burdensome topic to deal with alone sometimes, and talking to someone you trust can be very beneficial. There are also many support groups and counselors available at hospitals and private practices. You can also find support groups at funeral homes and places of worship, or in national grief support centers, and even online. Remember that you are never alone when it comes to death. Every living being will encounter it if they haven't already. Talk to someone and take death in your own hands by creating your own death plan.